Hello, Dr. Gladd.
Hi.
My husband is on 3 different blood pressure medications twice a day. And I've read articles that have explained that sometimes that's due to high sugar intake and inflammation. And so he's on a DASH diet of like 1,600 to 2,000 calories to see if maybe we can control some of his blood pressure through his diet.
Mm-hmm.
But I know that other articles say that you should add turmeric and omega-3 oils and garlic. And so I was wondering if you could help me prioritize what else we should add to his diet, like through vitamins and stuff, to help get control of his blood pressure.
Sure. Yeah, I mean, the DASH diet is sort of the traditional evidence-based approach to diabetes. I'm not particularly a big fan of the DASH diet. I would focus more on whole foods and really try to minimize and certainly all types of sugars, because I do believe that it's glucose and it's insulin that's driving a lot of blood pressure issues. And so really the mainstay of the diet should be fruits, vegetables, beans, nuts, non-breaded meat and fish, eggs and oats, and really focus hard on those whole foods and finding different creations and combinations of doing that. Regular exercise obviously has a big role in blood pressure control too. Supplementally, making sure the vitamin D level is optimal is a big piece of blood pressure. So I'd put vitamin D, fish oil, and coenzyme Q10 as the top 3 in regards to potential for lowering blood pressure. It may only be a couple points, but I also think the other added benefits are there and worthwhile doing. Below that, I've not seen garlic do much, have an impact. I've not seen vitamin E have a great impact. So I would really stick with those 3. And then there's some interesting study on hibiscus tea a couple times a day. A couple cups of hibiscus tea has actually been shown to lower blood pressure as well. So it's definitely anchored by the entire lifestyle piece, which is heavily involved in nutrition. And again, I wouldn't worry as much about calories as I would as where those calories coming from and the quality of those calories, making sure they're whole foods and not things from packages and processed versions of foods, and definitely some regular exercise. But those 3 supplements I would put at the top of the list.
Okay, now Dr. Gladd, you said vitamin D, fish oil, and what was the third one?
And coenzyme Q10, CoQ10 is a good cardiovascular supplement. It's been shown to drop blood pressure a couple points, and I actually should add magnesium as a 4th one there. Magnesium is a great way to try to relax the blood vessels a little bit.
Thank you very much, Dr. Gladd.
You're welcome.